Welcome to Ready Set Baby. Ready Set Baby is a class created by the Carolina Global Breastfeeding Institute that's designed to help you get ready for your new baby, even if you've had a baby before. We'll have a conversation today about infant feeding and provide you with the latest science and recommendations so that you can make an informed decision when it comes to how to feed your baby. During this class, it might be helpful to follow along with the companion booklet, or you may prefer to review the booklet later. If you do not have the Ready Set Baby booklet, ask your provider for one, or you can download it from the Healthy Active Arkansas website at healthyactive.org. During this class, we'll cover information to help you prepare for feeding your new baby by sharing with you some tips for staying healthy in pregnancy and beyond, some facts about infant feeding that you may not have known, and we will discuss what to expect while you're at the hospital or maternity center, including some breastfeeding information that will help you get off to a great start with breastfeeding. We will also discuss what to expect when you are back home with your new baby. And at the end of the class, we'll provide you with resources you can contact if you would like more information or need any additional assistance. So let's get started. Staying healthy during pregnancy and beyond. Overall eating recommendations don't change when you're pregnant, but there are some important things to consider. In addition to eating a balanced and healthy diet, you want to be sure to take a prenatal vitamin daily and make sure you stay hydrated by drinking water and other unsweetened beverages. Water is the best choice for hydrating your body. So, what does a healthy and balanced diet contain? Try filling half of your plate with fruits and vegetables. Choose high-fiber whole grains like oatmeal, whole wheat, or brown rice, and choose heart-healthy dairy products like low-fat milk, yogurt, and cheese. You'll want to select lean protein sources like seafood, poultry, eggs, beans, nuts, and seeds. But if you are on a special diet prescribed by your doctor, such as for gestational diabetes or food sensitivities and allergies, continue to follow the recommendations of your provider. If you have concerns or more questions about your diet, ask your provider for a referral to a registered dietitian. Yes, you are eating for two, but you want to make sure you eat healthy for two. What have you heard about infant feeding? Each of us have a unique opinion on infant feeding formed from our own experiences and those of others we know. In this class, we will review the facts about infant feeding, some of which you may not know. Did you know that most women breastfeed? At least 82% of all women in the United States breastfeed. Breastfeeding is the normal way to feed an infant. Did you know that your breast size and nipple shape do not matter? A woman's body was designed to make milk. Small breasts can produce a full milk supply, and babies can breastfeed fine on large breasts. Babies can latch onto many different types of breasts and sizes of nipples. Did you know that your milk contains hundreds of nutrients that scientists are only beginning to discover? Breast milk is a living, constantly changing food that provides everything your baby needs to grow and be healthy. The living parts of your milk are unique to you. Breastfeeding has too many benefits to cover in one class, but here are some major benefits that you need to know. Breastfeeding is free, convenient, always ready, and the perfect temperature. Breastfeeding is perfect infant nutrition. Your body makes milk especially for your baby. Breastfeeding helps protect your baby from illness by passing on your antibodies. Breastfeeding protects your baby from SIDS, sudden infant death syndrome. Breastfeeding will reduce your child's chance of developing type 2 diabetes, obesity, and heart disease. Breastfeeding lowers your risk for both breast and ovarian cancer. And it is possible to breastfeed and return to work. You can breastfeed anywhere, even in public with a little practice. Even if you smoke or take medications, breastfeeding is possible. Many medications are considered safe to use while breastfeeding. Talk to your healthcare provider for help determining if your medications are safe. If you are going to smoke, it is still better to breastfeed than not to breastfeed, but talk to your doctor about quitting aids and available resources. Secondhand smoke can increase your baby's risk for many health problems, and chemicals in cigarettes do pass through breast milk. Preparing for your maternity center stay. So what have you heard about the stages of labor? What about pain management? There are many ways to help cope with the pain of labor that do not involve medication. Many women find it easier to cope with early labor at home. Call your provider when you think labor has started and follow their guidance for when to go to the hospital. Before you deliver, talk to your healthcare provider about your options for pain relief during labor. Know the benefits and concerns for each method. While non-medicated vaginal birth with immediate skin-to-skin contact is optimal for getting breastfeeding off to a good start, women who have received an epidural or other anesthesia can still breastfeed. Skin-to-skin contact keeps your baby warm and secure. It's the best place for your baby to be after birth with as little interruption as possible. Your baby should be placed skin-to-skin with you right at the time of birth. If you deliver vaginally, your baby will be placed skin-to-skin immediately after birth. And if you have a C-section, you will hold your baby skin-to-skin as soon as you are in recovery. When you hold your baby skin-to-skin with you, it helps regulate their temperature by keeping them warm. It helps your baby adjust to life outside of you by regulating their heart rate, breathing, and blood sugar levels. Skin-to-skin also reduces stress in the newborn and keeps them calm and allows your baby to breastfeed as soon as they are ready to. Skin-to-skin benefits you too. It will help you bond with your baby and increase your breast milk production. It's important to note that the benefits of skin-to-skin do not end in the hospital. You should hold your newborn skin-to-skin often in the first several days after birth. Rooming in during your stay. It's good for you and your baby to stay in the same room, day and night, for your entire hospital stay, unless a medical need requires separation. Your baby takes comfort when you are close by. Your smell and your voice are calming to your baby. Before you deliver, decide which family member can stay with you at all times to help support you as you learn to care for your newborn. If you feel unable or unsafe to care for your infant, ask your hospital staff for extra help. The benefits of rooming in with your newborn are many. It's easier to learn your baby's feeding cues, and you can feed anytime your baby is hungry. It also helps you learn to care for your baby while you bond and get to know each other. And the baby's bath can be done right in your own room. These are just a few of the many benefits of rooming in during your hospital stay. Feeding on cue. How will your baby tell you when he or she is hungry? Babies communicate with easy to recognize signs that tell you when they're hungry or full. While rooming in, you will learn your baby's hunger and fullness cues to know when to begin and end a feeding. You will learn to watch your baby, not the clock, and feed your baby on cue. Some common hunger cues include fluttering eyes or waking from sleep, rooting, where they open their mouth and turn their head towards you, bringing their hand to their mouth, sucking on their tongue or their hand, holding tight fists at the center of their chest, and crying. If you miss some cues and wait until your baby cries to feed them, they may be too upset to eat. If this is the case, calm them first with skin-to-skin contact. Some common fullness cues include slowed eating, turning their face away, relaxing their arms and body, or they stop sucking or fall asleep. Newborn tummies are very small. In the first few days, there may be times where your baby eats a little bit nearly all the time. Very frequent feeding in the newborn period is normal, and the frequent feeding helps bring in a good milk supply. While rooming in and keeping your infant skin to skin, you will learn to trust the signs and cues your infant is showing you. Even if your baby just fed an hour ago, if he or she shows you hunger cues, it is okay to feed again. Frequent feeding is normal. Watch your baby, not the clock. Early and exclusive breastfeeding, your milk and nothing else. Early and exclusive breastfeeding means that your baby needs your milk and nothing else. Breastfeeding soon after birth helps you to recover quicker and slows bleeding. Doctors recommend that you feed only your milk for the first 6 months, but any amount of breast milk for any amount of time will benefit your baby's health. Feeding on cue helps your baby feel safe, cared for, content, and satisfied, and it helps bring in a good milk supply. It's important to note that some moms cannot breastfeed for medical reasons, and some breastfeeding babies may need extra milk. Together, you and your healthcare team will find the best infant feeding plan for your family. We have learned a lot in recent years about how beneficial breastfeeding is not only for the baby, but also for you, the mother. The benefits of breastfeeding extend well beyond the first year of life. There is no recommended time to stop providing breast milk. You should breastfeed as long as both you and your baby desire. Breast milk continues to provide nutritional and protective benefits to both mom and baby for as long as it continues. Benefits of breastfeeding for moms include convenience. Breast milk is always warm and ready, nothing to buy or prepare. There is a lower risk of breast and ovarian cancers as well as type 2 diabetes. Breastfeeding helps your body recover after delivery and can increase the time before your next pregnancy. Breastfeeding has many benefits for babies as well. Your early milk, colostrum, is the perfect first food for your baby. It provides antibodies that protect them from ear infections and stomach bugs. Breast milk is easy for your baby to digest, and your baby will have a decreased risk of developing diabetes during their lifetime. And breastfeeding is very convenient. There will be nothing to mix or prepare for those late night feedings. Good body position for both you and your infant helps your baby get a deep latch, which prevents nipple damage and pain. A good latch also helps your baby get more milk. Leaning back, lying belly to belly with your baby, is the most natural thing to do immediately after birth, and the nurses in the hospital will help you. There are other positions to learn, such as cross-cradle, football hold, and side lying, but no matter what position you find works best, latching your baby will take practice and patience as you both learn. Here are some tips for latching your baby in any position. Position the infant belly to belly, up high at the level of your breast where you are not straining to keep his body in place. Hug their body into yours with as much of their body in contact with you as possible. When baby opens wide, tuck their whole body into you. Their chin should touch the breast first. Make sure the nipple is deep in the baby's mouth. Their nose will gently touch the breast during a deep latch. Please review pages 12 and 13 of the Ready, Set, Baby booklet for details on all of the basic breastfeeding positions, including links to some instructional videos on hand expression. Hand expression is a technique to express milk from your breast to feed your baby immediately or store for later. The amount will be just drops in the beginning, but increases as you have more milk supply. You can also express a drop of milk onto the nipple for your baby to taste and smell before feeding. Hand expression can increase your milk supply and encourage your mature milk to come in faster. The nurses in the hospital will instruct you on how to do hand expression before you leave the hospital. Making and maintaining your milk supply. Like we talked about earlier, your first milk, colostrum, is thick and golden. It comes in very small amounts, yet it's full of nutrients and immunities, just what your baby needs. Your milk will change over the first 3 to 5 days into larger amounts of mature milk, which has more water content to satisfy your baby's thirst. When the amount of your milk increases, it is often referred to as your milk coming in. This is misleading because your breasts were not empty before this time. Colostrum is milk. When your baby removes milk from your breast, your brain gets the signal to make more milk. Making milk requires frequent feedings, at least 8 to 12 in 24 hours. If you do not remove milk from the breasts, your body will not make more milk, and this can lower your overall potential milk supply. Frequent removal of milk drives milk supply. You've got to move it or lose it. If you are separated from your baby, your nurse can show you how to hand express or pump your milk. You should use breast massage, hand expression, or pumping to remove milk and keep making milk if you are separated from your baby. You can find more information about pumping and hand expression on pages 12 and 13 of your booklet. There is no need to measure how much milk your baby eats. Keeping track of wet and dirty diapers and weight gain tells you he or she is getting enough. It is actually common for babies to lose weight in the first week of life, but they should regain it by 10 to 14 days. Some good signs to watch for to know that your baby is taking in enough milk include a deep latch that feels like a comfortable tug, steady sucking and swallowing with the whole jaw moving and short pauses, a content and more relaxed baby after a feeding, a gradual change in your baby's poop from a greenish black to a lighter color is a good sign. Stools will be pale yellow, soft and seedy by the end of the first week. You can refer to your Ready Set Baby booklet, page 15, for additional signs to look for. Keep your booklet for reference after you go home. In this class, we have gone over a lot of information. Here's a review of the practices that are most important for you and your newborn. Stay healthy during your pregnancy. This helps your baby grow and develop and protects your baby from birth defects and will help you feel good. Skin to skin will keep your baby warm and secure, balance his or her blood sugar and breathing, makes it easier to bond with your infant, and helps calm your baby. Breastfeed. Breastfeeding provides antibodies to your baby and provides perfect nutrition. Breastfeeding protects you against diseases like high blood pressure and diabetes and slows postpartum bleeding. Only give breast milk. This will keep your supply of breast milk up and protects your baby from sickness and disease. Rooming in 24/7 at the hospital makes it easier to learn your baby's cues, and it's easier to bond and get to know each other. It also helps you learn to care for your baby, and it encourages milk production. Feeding on cue will help bring in a good milk supply, prevent under and overfeeding, and help your baby feel safe, content, and satisfied. Get a good latch. This will prevent nipple pain and damage, help baby get more milk, and improves milk supply. The first few weeks changes for your whole family. What plans have you made for help after delivery? Responding to your new baby's needs can be challenging in the beginning. Be patient with yourself during this time. It does get easier. Here are some tips to help make your first weeks at home easier. Plan to nest in with your family after getting home and limit visitors and phone calls. Give yourself permission to take care of yourself and your baby and do nothing else. Taking good care of yourself will help you take good care of your baby. Be sure you get plenty of fluids, food, and rest. Create a network of support before your baby is born. What friends, neighbors, or family can you ask to help? Be mindful of your mood. Some changes in mood is normal, but you should ask for help if you experience unusual sadness, worry, anxiety, or depression. Preparing for other caregivers, going back to work or school. Many women continue to feed only their milk to their babies even after returning to work or school. Planning ahead will make things go easier. There are some things you can do to make this easier. You'll want to breastfeed as much as possible while you are with your baby and pump your milk into a storage container for later use while you're separated from your baby. Pumping while you are away will help you continue to produce enough milk for your baby and will provide the milk for feedings by other caregivers. Many employers provide lactation rooms or a space for mothers to use, and many insurance providers reimburse the cost of a personal breast pump. Continuing to breastfeed will mean less sick days for you because your baby will be sick less often. What is your plan for when you go back to work or school? Be sure to refer to page 18 of the Ready Set Baby booklet for more tips and information. Your loved ones will want to help out after delivery. Tell them ahead of time how to best support you in a way that supports you and your baby to breastfeed. It's important to help partners and family feel included in newborn care since they cannot breastfeed. They can do other things to get to know your newborn, like practicing skin-to-skin contact, giving baths, holding the baby, and learning infant massage. Encourage them to learn about breastfeeding, to support you in your efforts, and provide comfort to you as all of you adjust. How do your loved ones feel about breastfeeding? Breastfeeding is a team effort. There are a lot of ways they can support you. Refer them to page 19 in the Ready, Set, Baby booklet to show them examples of how they can help. Sometimes parents have concerns in the first week or two, like how to know you have enough milk, how to know your infant is getting enough milk when they breastfeed, or it may be painful to breastfeed. These and other common concerns are addressed on page 20 and 21 of the Ready, Set, Baby booklet. Anytime you have concerns about your baby's health or well-being, contact your healthcare provider. Resources for support. There are many groups and organizations that exist to provide mothers confidential support when they need it most. Many maternity centers have clinics to help with breastfeeding, and your local WIC office and health department are also good resources. You are not alone. What kind of resources have you discovered in your community? The Ready, Set, Baby booklet lists nationwide sources of support on page 22. When you are discharged from the hospital, ask for a list of local resources that can help you with breastfeeding and newborn care.